Good afternoon, everyone, and welcome to our 27th community conversation addressing planning, response, and operations in the time of COVID-19. I'm Joe Helble, the Provost of Dartmouth College, joining you from the Star Instructional Studio in Berry Library on Wednesday afternoon, April 28th, 2021. I'm joined, as always, by Justin Anderson, our Vice President for Communications, from another studio here on campus. And Justin and I are joined today by two guests who've been with us many times, including on our very first community conversation of April 29th of last year. Lisa Adams, MD, a professor in the Geisel School of Medicine, the co-chair of Dartmouth's COVID-19 task force, and a specialist in the care and treatment of infectious disease. And Josh Keniston, our VP of Campus Services, VP for Institutional Projects, and co-chair of Dartmouth's campus-wide COVID-19 task force. We'll follow our regular format with a brief campus update, live Q&A moderated by Justin, a conversation with Lisa and Josh about campus operations and also about the state of vaccinations, and then ending with an opportunity for them to answer your questions directly. Today, I have several operational updates to provide on vaccinations, research protocols, and anticipated changes for summer. But let me start, as I do most weeks, with our regular update on testing and case counts as we near the end of week 5. Hard to imagine that we're already here. The end of week 5, the halfway point of the term for undergraduate, Thayer, and Guarini students. Now, when we gathered 2 weeks ago, I acknowledged that there had been lines at the testing center at the start of the term. I mentioned the steps we had taken to address them, and I indicated that I was confident that these steps were addressing the issue. The quick update is they have. Things have been running smoothly at Leverone Testing Center the past 2 weeks. And so I'd like to just pause and thank our students once again for their patience, thank our staff for quickly working the problem, and thank our partners at Axiom Medical for their collaboration and their support in fixing things and making it work smoothly once again for our community. In terms of the results of our surveillance testing, at Dartmouth these past 2 weeks, we've seen a continuing decrease in positive tests relative to the end of winter term. In fact, we've returned to the very low positive test levels we saw during much of fall term. Over the past 2 weeks, we've conducted 17,537 tests and had a total of 10 positives for a positivity of 0.06% in that period. Over the past 12 days in the student community, we've had a total of 4 new cases, and in fact, we had 8 days with 0 new student cases reported, again, bringing us back to the kinds of levels that we saw in much of fall term. For calendar 2021, our overall positivity for students and employees combined, meaning all of our testing, is therefore down to 0.24%. And since the very start of testing on July 1st, 2020, we have now passed the 200,000 test level, a staggering number that was hard to imagine when we began this back in July. And we've conducted 200,915 tests as of yesterday and as reported on our dashboard, with a total of 393 positives and an overall positivity of 0.20%. Now, these are very, very positive trends. And I'm hopeful that with the spring weather that started to arrive and our ability to spend more time outdoors, still masked, still avoiding large gatherings, still distancing in accordance with campus and town rules, the downward trend will continue. Now, in terms of trends on other college campuses these past 2 weeks, for our Ivy peers reporting data, the downward trend continues on their campuses as well. For the year 2021, all of our peers in the Ivy League now lie between 0.13 and 0.66% positive test level. Our NESCAC peers are currently reporting positivity ranges from 0.04 to 0.29% for calendar 2021, roughly the same level that they were at 2 weeks ago. And our local state university peers, the University of Vermont and the University of New Hampshire, are at 0.32 and 0.57% respectively for 2021, also down from their levels 2 weeks ago. The states of New Hampshire and Vermont are among the national leaders in percentage of the population that have received at least one dose of the vaccine, both states now above 50%, and in fact, New Hampshire at 60%. Perhaps not surprisingly, the number of new cases in each of our two states has fallen sharply the past 2 weeks, a very encouraging sign for the local community and for our region as we move towards opening up greater access to our campus and campus activities over the course of summer term. Moving now to vaccinations. As we announced late last week, Dartmouth has partnered with the state of New Hampshire to offer on-site, and by this I mean at Dartmouth, vaccination clinics. These clinics are now open to all Dartmouth students currently in the Hanover area and to all Dartmouth employees. And as announced yesterday afternoon by our task force co-chairs, Josh Keniston and Lisa Adams, these clinics are also now open to all dependents, partners, and household members of Dartmouth students, staff, and faculty who are 18 or older, regardless of residency. Clinics will be held on Wednesday, May 5th and Thursday, May 6th from 8:30 a.m. to 7:30 p.m. in Thompson Arena. In addition, to provide flexibility for our community, the state will be providing both the 2-dose Pfizer-BioNTech vaccine and the single-dose J&J Jensen vaccine. The first dose of Pfizer will be offered to any appointment scheduled between 8:30 a.m. and 5:30 p.m. on both dates, and the clinic will then offer the J&J shot from 5:30 to 7:30 p.m. Now, I need to stress, appointments are required. There will not be walk-in opportunity. Registering is simple and straightforward, but appointments are required. And this is important because the number of doses we receive from the state of New Hampshire is based on the number of appointments scheduled. Everyone who gets the 2-dose vaccine will be able to get the second dose here on campus at our clinic before the spring term ends. Now, as Josh and Lisa indicated in their email yesterday afternoon, if you have already scheduled an appointment, then you're automatically signed up for a Pfizer-BioNTech spot. If you would instead like to receive the J&J single-dose vaccine, you must reschedule by canceling your current appointment and then select a new appointment time. And you can do this by visiting https://health-clinics.dartmouth.edu. And details again were in Josh and Lisa's email of yesterday afternoon. And again, a reminder, you must sign up to be able to receive the vaccine at Dartmouth on these dates next week. The number of doses, as I said, is based on the number of appointments scheduled. The deadline to sign up for students, employees, and dependents and partners alike is 11:59 p.m. Eastern Time tomorrow, Thursday, April 29th. Dartmouth students, staff, and faculty can sign up by going to dartgo.org/vax appointment. That's VAXAPPT. And dependents, partners, and household members can sign up at dartgo.org/vaxregfam or VAXREGFAM, single word. And again, that was contained in Josh and Lisa's email of yesterday afternoon. Once vaccinated, we do need students and employees to upload their vaccination information as soon as possible. Students are asked to submit proof of vaccination through Dix House with information available on the Dix House website. Employees are asked to provide proof to Dartmouth's occupational medicine partner, Axiom, and provide consent to Dartmouth's limited use of this information by completing the form at dartgo.org/vax or VAX. Now, we know that students and employees alike have been getting vaccinated, and yet the percentage of the undergraduate student community that thus far has confirmed that they have been vaccinated is 12% overall and 17% for those who are on campus or here in the Upper Valley. And not that this is a competition, but I will note to all of our students that 2 of our professional schools are already well beyond the 30% level. And not to name names, Tuck and Geisel, but it's great to see you progressing at such a rapid rate. And I hope you will drive us to the 70 to 90% level we need to achieve herd immunity in your communities and set an example for the rest of the campus. A reminder to all of us that while this is a strong start overall, we still have quite a ways to go to reach this overall 70 to 90% goal and achieve herd immunity. Now, I'm pointing this out for two reasons. First, as a reminder to register for the on-campus clinic if you haven't already, and also because over the past week, we've been receiving many messages from students and parents alike asking for more in-person activity this summer because of the general observation that nationally vaccination is progressing rapidly. While that is true nationally, and in fact it is true in our region, the numbers that I just cited show that we are not yet there on our campus. Broad Dartmouth campus community vaccination is an important step in our considering more in-person opportunities and activities and engagement with faculty this summer. I cannot stress that enough. Broad Dartmouth campus community vaccination, again, reaching herd immunity, is essential for us to return to a planned normal campus experience this fall, which means residential education in the classrooms, in the laboratories, in the studios, and on the stages, and a broad range of co-curricular activities. So for students and families who are asking, what does fall term look like? Fall term looks like residential operation in the classroom and in co-curricular activities. But we need you to partner with us to get vaccinated in a timely fashion so that we can see well before the start of fall term that we are on the necessary trajectory to achieve herd immunity by the start of the term. To students who are here this term and to our employees, we therefore encourage you to begin the vaccination process as soon as possible. And I'll say again and for the last time, including next week through one of the Dartmouth clinics, and we ask you to upload your records as soon as you have received your final dose. And just a note to our employees, a reminder that all employees are eligible to take time off to receive their vaccine. And remember, for all of you who have gotten vaccinated and uploaded your confirmation information, you will be able to begin a reduced surveillance testing regimen of only one time per week. Now, looking ahead to the end of spring term, I know that there are many questions regarding commencement. First, for our students who will be marching either in their investiture ceremony or in commencement or both, just a reminder that if you are not presently in the Hanover area and are planning to return to campus for commencement, if you've been fully vaccinated in the United States, you must submit proof of vaccination to Dick's House as soon as possible and no later than at least 7 days before your arrival on campus. If you're not fully vaccinated and will not be fully vaccinated by the time of your travel back to Hanover, then our travel policies apply with different rules depending upon whether you are coming from elsewhere within New England or outside of New England. All require a negative PCR test, generally 72 hours in advance of your first ceremony. Details will be conveyed by the individual schools in the coming weeks with dates specific to their ceremonies and also posted more generally in early May. Second, I know from the many emails I've received from Dartmouth families, and I know as a parent myself, that there is special significance of the commencement moment for many. I know that it feels different without family present in the stands. And this is perhaps the only moment in my many years at Dartmouth where I have wished we had a stadium that seated tens of thousands of spectators so that we could easily and safely accommodate guests for every graduate as we do in normal times with people packed closely together on the green. But we all know that we do not have a stadium that accommodates and seats tens of thousands of individuals. We are, however, encouraged by trends these past 2 weeks in case counts nationally and regionally where we have seen a steep decline in positive test levels. And we are exploring ways in which we could allow students to bring up to 2 guests ticketed to investiture or to commencement, and do so in a way that is consistent with campus rules and local community rules, which are expected to be in place at that time. Now, I had hoped to be able to provide more detail today, but we are continuing to explore options, again with the goal of allowing every student who is currently planning to march in our ceremonies to invite 2 guests, and these would be ticketed events with specific assigned seats. We anticipate saying more on this in roughly the next week. And I know that my simply saying today that we're pushing hard to find a way to make this happen is going to elicit many questions about details which we cannot yet answer. I am telling you this today because it has been our commitment in these conversations from the beginning to be open and transparent about issues that we're working to and working through and the time frame over which we hope to be able to bring them to resolution. I'm doing that here. And I therefore need to ask for your patience as we try to finalize what will be feasible within local and state guidance and guidelines, and to the maximum extent, equitable and fair for all of our schools, all of our programs, and all of our graduates. Again, we're being transparent and saying we would like to make this happen, but we cannot yet promise that it will be possible. Once more, I ask for your patience, and we anticipate saying more on this within roughly the next week. Now, let me offer a few thoughts on summer session, as we also have gotten many questions over the past week, particularly from parents asking why we are not yet requiring that all campuses or all classes rather be taught in person during summer term. Last June 29th, when President Hanlon and I announced Dartmouth's operating plan for the year, we presented a plan that was a full year integrated plan that offered approximately 50% of our undergraduate student community the chance to be in residence in any given term, offered students some agency or some choice in expressing preference for particular terms, and stressed two key foundational principles: supporting and prioritizing the health and safety of the community, meeting students, employees, and the local community alike, and ensuring the continuity of educational opportunity for all of our students. When we articulated this integrated plan for the year, we stressed that we were providing opportunity for all students to access most of our available curriculum through this term, this summer term, which is the fourth term in our four-term plan. This summer, for a variety of reasons, approximately 20% of our undergraduate student community will be studying remotely and will not be able to be here with us in Hanover. Those students need to have access to a broad set of curricular offerings as well, and that is why we are not requiring all classes to be taught in person this summer. In addition, although guidance, including masking guidance, is changing rapidly, we are not remotely close to herd immunity, as I said earlier in my remarks, and we will not be there by the start of summer term. That is our intended and stated goal for the fall term. Finally, our commitment to the faculty in asking them to pivot overnight last spring to online learning was to give them the choice and to trust them as our colleagues, as our students' teachers, as the individuals who know best how to teach a class of mixed learners, the flexibility to decide how best to engage students in challenging and engaged learning in their subjects and in their classroom. We are standing by that commitment to our faculty. We are still in a pandemic, and I know that all of us are so tired of this. And the slopes of the trend lines are positive, but that doesn't change the fact that we are, in fact, still in a pandemic. There will be more in-person classes this summer. I recognize it's not as many as all would like, but I am confident that this summer is going to be a significant step forward from the spring, and I am confident that if vaccination levels rise as we approach summer term, more of our faculty will be open to adding in-person elements or having in-person conversations with students, office hours, and one-on-one meetings as summer term approaches. Let me just end this by saying once more, our goal and our intention is for all or nearly all of our classes and labs and studios and stages to be in person this fall. Now, let me end with just a minute or two of quick updates on some spring term items. First, in terms of access to research facilities, Vice Provost for Research, Dean Madden, announced earlier today some additional flexibility for laboratory research, which takes effect on Monday, May 10th. On May 10th, we will move to phase 3 of our research ramp-in plan and protocols, which will remove restrictions on hours of operations in research buildings, reduce but not eliminate physical distancing requirements in some laboratory settings, and make adjustments to disinfection protocols for shared equipment. All of this should allow for some expansion of the level of research activity starting immediately on May 10th. Second, in terms of community activities, yesterday we held our first Tuesdays Together gathering, where Lou's Donuts and Cookies, and thank you very much to those who planned this, were handed out around campus. It was a chance for me to speak with a few students and see a few colleagues in person, many of them for the first time in more than a year. Thanks to all who helped out. Thanks to all who came out. And I look forward to seeing all of you at the next one on May 10th, or perhaps shortly thereafter that week, details to be announced as the date approaches. I'm also happy to announce that Live at Collis will launch this weekend, as long as the weather permits, with live musical performances. This week will feature a senior showcase with 6 seniors performing, and I believe this is outdoors. We'll also be starting a weekly outdoor movie night on Saturday nights, the first showing on Saturday, May 8th, with details to be provided next week. This is a collaboration between the Office of Student Life and Hop Film, and it will show a mixture of new releases and some fan favorites. So come out, be outdoors, see a few members of the Dartmouth community in person, and take in a film. Screenings will take place on the Kemeny courtyard behind the library. And finally, as of today, tents located at Cutter Shabazz, Blunt, Hitchcock, Moore Plateau, Streeter, and Wheeler will be open from 10 a.m. to 10 p.m. Sunday through Thursday, and 10 to 11 on Friday and Saturday. The tent located at 53 Commons will be open for dining from noon to 7:30 p.m. 7 days a week. It will also be open for informal gatherings from 7:30 to 10 Sunday to Thursday, and 7:30 to 11 Friday and Saturday. All events must be scheduled in the VEMS event management system, where the daily schedule will be posted for each tent. And if a tent is not scheduled, it is available for informal use gatherings at any time of up to 9 people. Tents are self-serve, which means you need to prepare and provide all aspects of your event support, but each tent has a base setup, which must be restored by the user after the event. Again, details are available through the VEMS event management system website. So with that, let me bring my remarks to a close. I look forward to an engaging spring term, the balance of spring term, and I am confident that given the significant progress we've seen in case counts and positivity rates, the improving weather, and the commitment of the Dartmouth community to get vaccinated, and I am counting on you for a commitment to upload your records, we can make significant progress and begin to see and engage more of our community outdoors or under the tents in the second half of spring term, starting today. Justin, over to you.
Thanks, Joe. And so nice, as always, to be with you on this dreary, unfortunately, Wednesday afternoon. I just want to echo what you acknowledged in your opening remarks about the flood of questions that we are receiving about summer term and whether or not it can be or will be in person, whether there will be in-person instruction. And you addressed a number of the reasons why that is a challenge. One thing that you didn't address, which I'd like to bring up again because it is filling up my inbox rather quickly, is an observation that a number of correspondents have made about the Hanover schools. And people have observed that Hanover, the elementary school, the middle school, and the high school have had in-person instruction all year, and Dartmouth hasn't. How come they can do it and Dartmouth cannot?
Right. Well, I mean, so it's a good question, Justin. First, I have to correct you. It is not a dreary day in Hanover. It is never a dreary day in Hanover. There is a refreshing gray mist settling upon the plain that will green and brighten everything we see in the morning. In terms of your question about the comparison to the high schools, it's an important point, but in many ways it's an apples and oranges comparison. So first you have to look at the physical facilities and ask what kind of ventilation system you have. in the room and whether that is sufficient to enable people to remain in close proximity to one another for longer periods of time. Second, the students are living in a congregate living situation, which raises the level of risk relative to them all dispersing to their home communities at the end of the day. Third, we are very attentive to the broad mix of activities that happen here in campus, where students are not just popping into a classroom for 30 or 40 minutes, but are spending long periods of time potentially in study sections together, working in design studios together, working in research laboratories together. And it is all of this collectively that we need to manage to support and promote the health of our community. And so I know that it's not a satisfactory answer for everyone, but the truth is every institution, every college and university is different. Comparing a college or university to a high school where you're comparing resident congregate living to students coming in and out over the course of the day are very, very different situations.
Thank you for that, Joe, and thank you for correcting me when I said that it was dreary. What I should have said is that it's just not quite as sunny as it was yesterday.
There you go.
Joe, you have stated repeatedly during community conversations over the last year that Dartmouth will follow the science in terms of how it is evaluating the situation and the decisions that will be made. How does science justify the limits on commencement attendance, the in-class instruction, and the visitor policy, given all of those great positivity rates that you cited earlier, as well as the number of tests that we're doing, and all of the numbers that are rather impressive and paint a positive picture, or at least a positive snapshot of what's happening at Dartmouth at the moment. So if we are following the science, a number of people have asked, then why aren't we opened up?
All right. Well, again, Justin, there are several different considerations here. And I think in part, when we talk about following the science, we have to be careful not to focus only on the best case situation and say that is what immediately applies here. What do I mean by that? For a commencement event, we are going to be bringing large numbers of people into town who are from outside of our community. We have no way of insisting that they are vaccinated coming into town. We can ask that they're vaccinated. We have no way of insisting and managing that vaccination, individual health information for people who are not part of our community. Second of all, there are pinch points in the process where people are in close proximity, moving into a stadium, moving out of a stadium, that require us, in an abundance of caution, to keep people reasonably separated from one another in the event. Third, we have to think about just the challenges of the mix of population that we have in town, the different ages of population, and the risk that this may pose to individuals who are older and, again, may not be vaccinated in a stadium setting. And then fourth, we are not prepared to have people in close proximity packed together, just as outdoor sports arenas are not having individuals packed together in proximity close together. And we are substantially limited by the size of our stadium. As I said earlier, if we had a 40,000 seat stadium, it's the one time in my life I wish we had that. It would make things so much simpler. The capacity of our stadium is actually under 10,000 for a configuration for graduation. And just the way the seats are aligned, it makes it extraordinarily difficult to maintain the recommended distance between people in what is a large event. This is not a small gathering, but a large event, keeping them safe and at distance from one another. And in terms of the classroom piece, just the last thing I'll say, there was a paper that was published just yesterday in the Proceedings of the National Academy of Sciences by some MIT scientists commenting on scenarios under which you can show that even with 6 feet of separation, there is risk of infection through aerosolization to other individuals in the classroom. It depends upon the mechanical ventilation of the room. It depends upon how well mixed the air is. It depends upon how effective the masks are. And so, again, there are indications that we will be able to move in a very positive direction over the course of the summer. We have to make decisions today about whether or not we can manage large crowds 2 months from now. That's what's limiting our ability to commit to saying to everyone, yes, commencement is open and you can bring 2 guests and we'll be able to make it work in the stadium with the crowd that would entail.
Joe, we have time for just one more question before we bring in Josh and Lisa. A viewer asks, what will Dartmouth do with the vaccination information that goes to Axiom? And I guess what will Axiom do with it as well? So what happens to those medical records?
Right. So actually, Justin, I think that question's best put to Lisa, but right now we are using it to track aggregate levels of vaccination within our communities. Full stop. That's the end. That's the end. That's the end of my answer. So right. Maybe I will turn and put that question to Josh and Lisa as a starting point. And so, Justin, if you don't have a follow-up, why don't we welcome Josh and Lisa to the screen and begin, if you don't mind, Justin, by my turning and putting that question that you just put to me to Lisa and Josh. What is it that happens with the vaccination information after employees upload it?
So I'm happy to help us get started with that one. So the information is stored on a secure server. It's entered through their secure portal. And really what we are using that information for is, as we have said, to provide some additional freedoms to people, a decrease in testing frequency. We know too that individuals will also, who are fully vaccinated, will also have greater travel freedoms. But really the main purpose for keeping it in a system by Axiom right now is so that it can be fed into the screening testing system, the reminder system, the system that says if individuals are in or out of compliance with their testing requirements. So that's the main purpose for which is being used right now. Josh, I don't know if you have anything you want to add.
No, I think you covered it, Lisa.
Great, thanks. So thank you for clarifying and adding to that. So let's turn now to another vaccination related question. And Lisa, here I want to start with you, although I've got questions for both of you. The J&J vaccine is again approved under emergency use authorization for use and administration within the US. And in some locations, including, as I announced earlier, at Dartmouth, individuals going through our clinic will have a choice. And our choice is Pfizer-BioNTech or J&J Jensen. So what questions should someone consider in making the decision about which vaccine to choose?
Yeah. So I think it's just great. We are fortunate to be getting to a point in our vaccine rollout such that ample availability now allows individuals to make a choice about which vaccine they receive. And this is good news. And as a clinician myself, I certainly support informed choice and patient empowerment when it comes to medical decision-making. Obviously, the J&J Jensen vaccine has the benefit of being a single dose. And we see a lot of people expressing preference for this vaccine because of that, because they want the convenience of a single vaccine appointment, because they want to be fully vaccinated on a shorter time frame, 2 weeks versus 5 and 6 weeks from start to finish with the 2-dose vaccines. And because they're worried about the undesirable local and systemic reactions, the fever, chills, aches that more commonly occur after a second dose. So this is actually a great option for individuals who have those preferences, and now they can make that choice. So I really do see it in many ways as an individual preference here. I will say that just a few words about resuming administration of the J&J Jensen vaccine. I listened very intently to the live stream of the ACIP meeting last Friday, where they discussed and eventually voted to reinstate its use. So now all sites, including our Dartmouth site next week, are providing this vaccine in accordance with the guidance that everyone is appropriately informed of the very low risks for serious adverse events including that rare blood clotting syndrome called thrombosis and thrombocytopenia syndrome. This updated warning has language that is directed at women under 50 who appear to be the ones at increased risk for this rare but serious disorder. So after reviewing the data, it became very clear to the ACIP and CDC that the potential benefits of preventing hundreds, thousands of hospitalizations and deaths far outweighed the risks with reinstating this vaccine. And lastly, I think it's important to add that the pause in administering the J&J Janssen vaccine should be seen as a positive. It was an example of the FDA and CDC's extensive safety monitoring system working as it was designed to work, identifying even these very small numbers of cases. So I see that as reassuring that vaccine safety is being taken very seriously.
Great. Thank you, Lisa. That's hugely helpful, I think, to many of us who are thinking about the choice between the two options in front of us. So Josh, let me turn to you now with a vaccination question as well. And this is on the logistics side. What can you tell us about the clinics that will be held next week? Again, appointments will be required and there's one more day to sign up, but where will they be? Who will manage them? And how's the process going to work?
Yeah, and I think, as you mentioned, Joe, a couple of times, and really important to emphasize, we do need everyone to sign up by tomorrow evening because we need to submit to the state the number of appointments that we have so that they can then issue us the right number of doses. So that piece is really important. So it's going to be in Thompson Arena, which we had a clinic today. It was a second dose clinic. Everyone will recall we earlier or a couple months ago had partnered with the state for some of our employees to get a first dose, and we actually ran a second dose clinic today. So the system is working well, and what people can expect when they show up is it's largely going to be staffed by Axiom Medical, which is our same partner for testing. We also have partners from the state and local levels, including the town of Hanover and Dartmouth EMS, helping to staff it. When you arrive, there will be some initial screening questions. These are the same questions you'd get at any vaccine appointment, making sure that there's not a risk factor that they need to be aware of. And then there'll be a registration process. And one of the nice things about being able to do this on campus is for our employees, our students, we actually have most of the information in our systems. So it's a really quick registration process. For those who are household members or dependents, there'll be a separate table. We'll need a little bit more information from them. And then you'll move on your way, get your shot, and then there'll be a brief 15-minute observation period just to make sure that everything went well. And what we're encouraging folks to do is, while they're waiting, use your smartphone and upload your records. So do it right there when you're done, when you've had your second shot, go ahead and take a picture of that and upload it. So it's a pretty smooth process, and it has the benefit of being right on campus, which for most people, if they're here, can walk to. So we're excited about it.
Great. Thanks, Josh, to you and your team and to everyone who was involved in setting that up. That convenience is extraordinary, and I'm really excited that we're able to offer that to the Dartmouth community, including family members. Lisa, let me come back to you with a question, and I want to ask about the breakthrough cases that we've been hearing about in the news. And I checked this last night. As of yesterday, there were 52 reported breakthrough cases in New Hampshire and 7,157 nationwide. And breakthrough means someone who's been fully vaccinated, then test positive subsequently for COVID-19 infection. The numbers sound large, but for context, there have been over 87 million individuals vaccinated thus far in the United States, which means fewer than 0.01% or 1 in 10,000 vaccinated individuals have shown breakthrough. And so for me, as I listen to the rhetoric around breakthrough in the media, it suggests it's a concern, but this is actually, from my perspective, a sign that the system and the vaccine are working exactly as intended. So you're a physician and a scientist, and what might you say to someone who's concerned about breakthrough and maybe even sees this as a reason to delay vaccination?
So I would say that breakthrough cases should come as no surprise to any of us, right? We know that none of our 3 COVID vaccines, and in fact, no vaccine in use today, is 100% effective. What we do know is that these vaccines are very effective at protecting against severe disease, hospital admission, and death. And hopefully that was clear from my earlier comments as well. So we know we are and will see some breakthrough infections in individuals who are vaccinated, at least until we get to a point where there's very little virus circulating. But the vast majority of these are going to be mild or even asymptomatic infection. So like you, I can't emphasize enough that the risks for an adverse outcome are much, much lower if you are vaccinated. And I also hope that seeing individuals develop these very mild breakthrough infections will actually help the vaccination cause, as we consider that it was likely their vaccine that led to their infection being very mild or even inconsequential. So this really should be considered a pro-vaccine moment in my mind. Of course, we're collecting information on the spectrum of disease and transmission of dynamics of breakthrough infections as more people are vaccinated. And of course, we hope that, that as disease prevalence decreases, really such breakthrough infections will become truly rare events.
Great. Thank you, Lisa. So building off that, I want to turn back to you, Josh, and this is a question not about vaccination, but about operations. But vaccination is certainly improving the state of health of the local and campus communities, and we are seeing case counts come down. And in accordance with this, I know the task force is working through recommendations for me to review related to the easing of some of our operating restrictions for summer term. Can you remind everyone of the color-coded levels of operation and just talk a bit about where we are now and where we hope to get sometime in June, perhaps, and what that means for operations this summer?
Yeah, absolutely. So everyone, if you were a regular viewer, you'll recall we had defined 5 levels that started at essential access only and progressed to full access. So currently we are at the middle level, which is called limited access. And earlier in the pandemic, some of the things we were looking for to move to the next level were things like access to testing, right? We've always looked at how are we able to safely move to these next levels. And I think as we are looking at where we are with the vaccine rollout, that's one of the key levers that's going to allow us to move to the next level, which is a dark green, less limited access. And really what we're looking for there is we're still going to be asking for people to try and help de-densify campus and to do things virtually or remote when they can. But if they do need to come to campus, it's going to be a little bit easier, that we're going to be able to increase capacity in some of our indoor spaces, that we're going to make it easier for visitors to come to campus. And so I think as we move towards June and start to see these high levels of vaccination among our community, I think we're optimistic that we'll be able to roll out these relaxed guidelines with the plan, as you've said, Joe, to ultimately get to that full access level by the fall.
Thanks. So Josh, let me just ask you one related follow-up question. I'll ask for a quick answer. And then Lisa, I want to put one last question to you before we turn to Justin and the outside questions. I mentioned earlier that tents are now up and around campus and they've been approved and permitted for use. So can you just tell us really briefly about capacity, potential uses, and what your thoughts are on tents potentially being available again this summer?
Yeah, so the tents are really designed as a great opportunity for folks to get outside and be able to hold their events. It follows our events guidelines. So if it's an organized kind of scheduled event, that can be up to 25 individuals in most of the tents. And then if the tents aren't scheduled, people are free to go use them. And those can be groups of up to 9. And I think we're going to watch them during the spring and see if they get a lot of use. And if they do, I think we'll continue them into the summer.
Great, thank you. And so, Lisa, let me give you the last question, and then we'll turn to Justin. And I want to ask you a breaking news question. So, as I'm sure you know, the CDC just yesterday indicated that outdoor masking requirements can be lifted under certain circumstances. So, what were your reactions to the release of these new guidelines?
Yeah, so I found this new guidance very encouraging. And for me, it reinforced a few key principles about viral transmission dynamics and infection control practices that we have been tracking and recognizing as important. So first, I would say it reinforced that the outdoors is safest. In one systematic review, I know that less than 10% of cases globally have been attributed to outdoor transmission. And in those cases where it does occur, we really believe that it's due to prolonged close contact without masks. We know that the outdoors is the perfect environment to reduce transmission. Right? We have fresh air rapidly disperses and dilutes the virus, and then sunlight also helps kill the virus. So recognizing the benefits of being outdoors is really part of the Dartmouth ethos. And so not surprisingly has been part of our approach and a part of our policies all along. I think we can think of the outdoor ice rinks, the fire pits, the Tuesdays together on the green, and now the outdoor concerts and other events that are being scheduled for being outdoors. So again, all of this is very reassuring and where I think we should be spending as much time as possible once it gets to be more sunny in Hanover. Secondly, this policy, in my mind, is about giving privileges to vaccinated people because being vaccinated makes you safer. Not completely safe, of course, but safer. And it also serves to incentivize people to get vaccinated. And of course, we're doing the same with changes to our policies for those who are vaccinated, since as we mentioned, the less frequent testing requirements and greater travel freedom and exemptions from quarantines, et cetera. So again, trying to find ways to really encourage people who maybe had been hesitating or sort of putting it off for now, really encouraging them to get vaccinated. Now's the time. You can get it done. You can get it done at Dartmouth. You can get it done locally near you. So that's all great news. But lastly, I will mention that the announcement of this new guidance actually came during my health epi meeting. So we actually quickly pivoted to look at the guidance and are now thinking together about how we can adapt it to our spaces, recognizing that we're still bound by town guidance, including Hanover's mask mandate, which I understand is still in place. But it's certainly exciting to see another incremental move towards that new normal that we are also so desperately craving right now.
Thanks, Lisa. Thanks very much. That's helpful insight as we think about it, and also respond to questions about why Dartmouth is not adjusting some policies immediately as the CDC issues new guidance. It's one of many factors that we have to be looking at as we make these decisions. So Justin, back to you to see what's coming in from our audience.
Thank you, Joe. And Lisa, if I could stay with you for the first question. And it's regarding the Johnson & Johnson vaccine and the fact that, we're going to be getting J&J doses now that they've been cleared for use. And how do you think that that bringing J&J back online will affect our community and its ability to have greater levels of vaccination by the summer? And does this mean that we'll have more students vaccinated by the summer, and as you just observed, perhaps more privileges because of it?
Mm-hmm. I certainly think so. Again, we know as people are registering for the vaccine clinic that we're going to be holding next week, we see some people preferentially choosing the J&J vaccine. Again, I think it's very nice as many of our students are in motion at different times to be able to not have to think about how and when to time and schedule a second dose. Again, I think it just provides that convenience, that freedom. And I think it will lead to more of our students being vaccinated, maybe more of our employees as well. But I do think having it as an option is going to provide greater flexibility for people. And I think and in some cases, greater acceptance and getting all of us, the Dartmouth community, the local community, the state, nationally, towards better vaccine coverage. And that's, as we know, herd immunity, that 70 to 90% target is really what we're aiming for.
Josh, if I could go to you with a sort of a related question, and it is about whether or not there would be different levels of access to different buildings or resources on campus for students or faculty or staff who are vaccinated. In other words, will their ability to travel more freely on campus once they're vaccinated increase? Or is it something that is going to depend on the status of the whole as opposed to the status of the individual?
Yeah, we're really using the status of the whole to determine our campus operations. I think as both Lisa and Joe have mentioned, the way that we're collecting this data with Axiom, tracking it or Dick's House for the students, it really is about having that information for kind of making decisions at the aggregate level and for helping with some of our testing cadences. But we really aren't in a position, we're not going to link that data to a key card, and whether or not you are vaccinated will indicate whether or not you have access on that key card. That's something that technically is difficult to do. And I don't think, from a philosophical perspective, we think that's the right direction to go either. And so really what we're advocating for is the more people that get vaccinated, the quicker that people go get those appointments and then upload those records, the quicker we can move through these phases, and that we can open up different aspects of campus to everyone that wants to get access.
Lisa, back to you with a question about vaccinations. A viewer writes in to ask if they have a mild response to a shot, whether it's the first or the second. And we're all hearing these stories that the second dose of the vaccine can really knock you out. A viewer writes in to ask if they don't have a severe or acute response to the first or second shot, does that mean that it's not working or that they got a bad dose? Like, how should people think about that?
No, that's a great question. I'm so glad that somebody asked that, because yes, everybody who's getting vaccinated is sharing their stories, about how flat out they were after their second dose. And some people feel like if they didn't have a bad reaction, something went wrong. And that is not the case. So let me be as reassuring as I can to say that it does not having a bad reaction after your first or your second dose does not indicate anything about vaccine efficacy. When the trials were done, certain percentage of people had, these intense local and systemic reactions after the vaccines, and some didn't, and all had the same level of protection provided. So it's really not a measure that the vaccine failed or your immune system failed in responding to it. It really is not correlated in that way at all. So there are reasons why some people's immune system may react in a different way and make them feel more sick than others, related to age and sex and other pre-existing conditions. But really, we don't think there's any reason to believe that if you didn't react, that your vaccine didn't take or that your immune system didn't respond. I say you just got lucky.
Josh, as we think about the coming months, and particularly as we look to the fall and what we expect to be all returning to campus, how is the task force thinking about, how are you thinking about the return of employees? Do you think it's going to be staggered? Do you think it's going to be staggered by function, by a building location? How are you thinking about how we bring employees back to campus?
Yeah, it's definitely going to be a transition period. Joe and Rick Mills, I think, had earlier talked about September 1 is kind of the date we put out there for when most people can expect to start transitioning back. We think there will be some transition that happens during the summer out of necessity as we open more facilities up, as we get to higher level of vaccination. We will just need more people on campus to support our operations. And that will be a good test for us. That will be a good experience to have some small numbers come back, make sure that we're all used to the kind of systems that we used to just take for granted in terms of how they operate. And that will build throughout the summer. I think we will see in August another kind of uptick. There's a lot of work that goes into preparing for students to arrive in the fall. And so I think there will be a kind of another, step we take there with some more folks coming back. And then really that September 1 date, encouraging more folks to come back. I'll also just note that Rick Mills, I think in his town hall noted There's also some conversations about those who maybe can continue to work from home. So this isn't kind of a flip the light switch approach. There are definitely going to be steps we take along the way, and it will be responsive to what we need on campus, and also, some one-on-one conversations that need to happen in certain areas as people rethink things that may be a little different in kind of a post-pandemic world.
Lisa, you in talking about the change in the guidance from the CDC on wearing a mask outdoors, you mentioned that the town of Hanover has not modified its position on masking. So, viewer writes in to ask, how do you reconcile all the various guidance, whether it's from the CDC or the state or the town? How do you factor all those in to say, okay, yes, we're going to change our guidance on wearing a mask outside, despite the fact that the state of New Hampshire says it's okay, but the town of Hanover says that please continue to wear masks. So how does the task force reconcile something like that? Certainly in this instance, but I suspect this kind of thing is going to be happening a lot as we move forward over the course of the coming weeks and months.
Absolutely. It already has happened a lot, and it's been an issue that we have been trying to sort of track and figure out which guidance we need to be beholden to. We have always said that we will be looking towards national guidance, state guidance, local guidance, and we may choose to be more conservative, more restrictive, given our congregate living setting. So we have always been balancing and trying to align. And as you point out, state, federal, town guidance don't always align. So we have to take that into consideration as well. We certainly have good lines of communication and communication channels with the town of Hanover. And in general, our outdoor spaces, I think we are really beholden to what the town of Hanover mandates. So that's sort of I think that's a relatively easy one. And we work with the town of Hanover when there are instances where we think we might want to have a momentary deviation or an exception made because of a particular event, such as graduation that we're going to be holding on campus. So, I think what we try to do is look at the guidance coming out from the different sources. Again, we can never be more permissive, feel than our state guidance, and which is typically aligned with our town guidance, and then see if in fact we need to be more restrictive in some cases. And when guidance changes, we look to see how that impacts, how do we apply that to our setting? So it's constantly, it's really a large part of the work that we do when we're setting health and epi policy.
Lisa, I'm going to stick with you for the last question, and it's the last question because we are running out of time and because I have to get over to Thompson to get my second dose of the vaccine. So we're going to really have to be out of here by 4:30. Okay. The last question is about boosters. So so I'm getting my second dose today, which is fabulous. I'm grateful for that. What are the chances that we're all going to be needing booster shots, 6 months from now or 4 months from now? And, how will Dartmouth be able to provide booster shots just like they provide flu shots annually, and just like, they're providing the not just the testing, but also the vaccinations?
Yeah, that's another great question that I hear a lot. And I would say at this point, we think that booster doses are likely in our future. The CEOs of both Pfizer and Moderna have stated that they anticipate boosters will be needed for their respective vaccines. But perhaps more importantly, our main authority on COVID, Dr. Tony Fauci, has also said this is likely to be the case. And I've heard it actually put this way, that the question isn't if we'll need another shot, but it's when. So At this point, we do have good data to suggest that our vaccines provide at least 6 months of protection. And I stress the at least because we only have data going out that far. It's probably likely that it's going to be beyond 6 months, but we just haven't been able to do the clinical trials to follow people for beyond 6 months and collect the data and do the analyses. So, you know, I think if we think about the flu shot as an annual vaccine that we've kind of, we're used to getting on an annual basis, but then look at the other end of the spectrum where we see the tetanus shot, right? That's something that you should get every 10 years. So I think the COVID vaccine might fall somewhere in between there. It may be something that we get every year, every 2 or 3 years. And, you know, I certainly hope over the summer, by the fall, that we will be learning more about when booster shots might be needed. I do know that the pharmaceutical companies are working on developing booster vaccines right now, and they're actually trying to figure out if the best booster is the one that you got initially, or maybe combining, you know, right, there are different platforms of really, maybe that's what's going to be the way to provide optimal protection. So there's just a lot more information here as this very hot topic continues to evolve. And I do know that we hope that we will be able to provide vaccines, COVID vaccines, much in the way that we provide flu vaccines currently.
Thank you so much for that, Lisa. That was really helpful. And thank you and Josh for joining us again on what I think Joe said was the 27th Community Conversations. Joe, I'm going to toss it back to you so that I can head over to Thompson. And I'll just leave you with, if you email me tonight or tomorrow morning, I might not respond as quickly as I usually do.
You're going to have a mild reaction, Justin, I can tell. Enjoy the second dose. So Justin, thank you. Lisa and Josh, thanks as always for joining us. And I just want to end by commenting on something you said, Josh, just now in the Q&A that struck me. You spoke about our decision-making process being focused on the status of the whole, right, to define the state of campus operations. And I can't stress enough, as we make these decisions, we are really looking at the status of the community health, what we can do, not to preference individuals who may have had vaccination and can operate a little bit more freely, but provide an environment that allows every student and employee to access activities and access their education in a comfortable and safe way. The more we approach herd immunity, the more members of our community who are vaccinated and upload that information so that we can track the data, the more quickly we can move to reducing restrictions on operations for all. So please, if you haven't heard it enough in this hour, let me end by saying I strongly encourage you to sign up for one of the Dartmouth vaccination clinics. Get vaccinated next week, employee, student, or student family member alike. Upload the information and help us move much more quickly to a more open and engaging in-person summer session this year. Thanks very much. Stay healthy and stay safe, everyone, and I look forward to seeing you in 2 weeks.